Palatal expansion in adults. Is it possible? I think from the questions from the public I receive, this is probably one of the most contentious issues that I hear about. There's a huge amount written with a lot of people almost acting as certain authorities to the fact, saying you can do this in this situation and you can't do that in this situation. Now, to my knowledge, most of all of these opinions come from 4 not particularly well done research studies. And all they tend to show is that when people are young, there's a greater chance of skeletal movement in expansion. And when they're old, there's a greater chance of dental movement in expansion. And also, that if you go really quite slowly, there's more of a chance of dental movement. And if you go really very fast, there's more of a chance of skeletal movement. Now, none of these papers show an absolute finding, and all of them were of relatively dubious quality. And my concern is that many of the authorities speak about what they have not been able to do rather than what can or can't be done. For me, skeletal expansion in adults is actually relatively normal. I come across a few people who, I struggle to expand, but that's quite a rarity. And I'm expanding frequently up to 40 years old. So it's very difficult to tell me that I can't do it when I do it regularly. Now, I wouldn't say it's that easy, but I guess it depends on how you do it. I will always aim to go at 1 millimeter a week, which is very different from either the conventional slow expansion or the rapid maxillary expansion sort of favoured by Haas, and really still quite common by many people, that I think is quite damaging, and I don't support rapid maxillary expansion. Behind as an adult, one of many cases that I've treated, this particular individual had a skeletal discrepancy that would be considered only possible to treat with surgery. She was in her late 20s, early 30s, and we treated her. I mean, it's got a few months. I mean, it's between January to August, but the treatment time was considerably shorter than that. It was about 4 months of expansion. We expanded her at a relatively normal rate. I had palatal coverage in a removable appliance. We corrected her skeletal asymmetry and facial asymmetry almost perfectly. And she had an appliance that was almost not visible. She's over the moon with the result. We're now going to very, very slowly allow the overexpansion in her right side to relapse progressively. And eventually we might do a few aligners just to tidy things up. This is a routine case for me. What I have asked her to do is increase her chewing force, her muscle effect greatly. I'm asking her to chew on specially designed chewies we have at least an hour a day, and I think that makes a fundamental difference. You want some high forces running through the system at all times when you want to expand. What's commonly noted is that people with higher bite forces have wider faces than people with lower bite forces. We know that the teeth sit in a balance between the lips and the tongue, as of course does the bone. You want to be moving teeth either through or into, and henceforth, if you do want to do some expansion, you've got to change the underlying principles. You have to increase the bite force greatly, and a sustained increase. Otherwise, I think you are going to ask for problems. But to say I can't do it, well, I do it routinely. Some individuals I can't do it in, but that is rare. Usually I can expand the maxilla in an adult.